Dr. Deborah Birx is in the White House. She's at the Coronavirus Response Coordinator working on this pandemic. Dr. Birx, it's very good to see you. Listen, I think many people were very relieved that the president decided to extend the deadline. What exactly did you all see that made you know that, listen, April, while it may have been aspirational Easter, it was not a good idea? So what are you seeing that convinced him to extend it?
Well, we're constantly integrating data from the global pandemic as well as what's happening in the United States. And we can see in Italy that as you flatten the curve, the duration at the top of the peak lengthens also. And so we can really project as best we can about what's happening in New York to the rest of the country. Certainly we're hoping that there aren't more New York cities and New York metro areas around the country, but we have to plan for that, and we have to really tell the American people that they have to do more to stay inside, to wash their hands, to social distance, and to assume that other people are infected even if they look asymptomatic.
So, Doctor, what exactly do you need to see? Because it's gone from mid-April to now the end of April. What exactly do you all need to see that will let you know it's okay to lift social distancing?
So by the time you're seeing cases in the hospital, we believe that it has gone from 5 to 50 to 500 to 5,000 and potentially even 50,000. That's the part we don't know. How many asymptomatic mild cases are there to every hospitalization case? And that's what we're going to be working on in the rest of the country that doesn't have these huge metro hotspots, to be able to do surveillance at the same time we're supporting the metro areas and other areas to do full diagnosis and treatment.
You know, we keep emphasizing social distancing. A lot of people still are not getting this memo. They're still on the beach. Over the weekend, we saw churches in Florida where the ministers were saying we're not going to be intimidated. They're shaking hands. The congregation is shoulder to shoulder. Do you think we have to have an official federal mandate? Because just asking people does not seem to be working in many places.
Well, I think the president's made it clear what the guidelines are, and the expectation that every state and local government will look at this closely and do two things: ensure that that's applying to their population, and secondly, prepare every region, every county, every hospital for a contingency plan if they get this kind of doubling of 5 to 50 to 500 to 5,000 to 50,000. We want every place in the United States prepared for that. So it's critical that even if you don't see it, it could be circulating in your community.
The president also still seems to be questioning the request for the number of masks and the number of ventilators. We just heard him say in We Just Peace it goes from 10 to 20 to 300,000. He says, where are all the masks going? Are you questioning what the hospitals are saying that they need?
I think what's really important here is to look at all aspects of the supply chain. What does each hospital have, and how are they being supplied? Are they being supplied by the private sector, or are they relying on the pre-movement of the stockpile that went into warehouses? It doesn't help any of us, and I know everyone realizes that, to have supplies there and not reaching the hospital. And I think that's the piece we have to get that piece right. And we're looking to make sure that the hospitals are too busy to define what they need. It is our job collectively, the state and local governments, along with us, to ensure that the hospitals are receiving the supplies they need.
Yeah. Is it concerning to you, though, that the president seems to doubt what governors are telling them that they need?
I think we're watching every single piece of data extraordinarily carefully. And we'll be able, when this is over, we'll be able to really have a flu pandemic plan that really takes all of this into account, where we can actually predict what the needs were. I mean, the stockpile was created to predict what the extra need was. Clearly, there wasn't enough in the stockpile to really meet the needs of all of America. And so really increasing the manufacturing, that has happened, and make sure that from manufacturing to hospitals, that this is happening, that hospitals are getting what they need, and that's what we're working on every day.
All right, Dr. Deborah Birx, we all know this is all hands on deck. We thank you very much for your time.